The value based healthcare model is defined as healthcare staff being compensated based on patient outcome. Immediately, I recognize caveats in this model in regard to specific specialties where the mortality rate is higher or patients come in with more complicated patient histories or overall ailments. That makes the value or rating of patient outcomes significantly skewed depending on the specialty. In addition to this model is not as widely used in our healthcare system in comparison to the capitated approach model, which compensates healthcare workers more notably on the services provided to the patient. Bunton's argument that shifting away from value based healthcare can contribute to the increase in healthcare spending has many flaws in the theory. The initial flaw that I noted was that in his argument, Bunton could not explicitly explain what was attributing to the slow growth in the healthcare spending. He explicitly stated, quote, low growth in healthcare spending cannot be fully explained by prices or demographic shifts, nor is it limited to a single patient group, geographic region, or type of care. End quote. He later goes on to discuss the effects of Medicare, economic recessions, or even government policies on health spending within the last 2 decades, but still could not definitively say what aspect of healthcare is contributing most or significantly to the lack of growth in health spending. Without properly noting what is keeping the growth steadily low, we cannot surely say that a value based healthcare model would impact the system to such an extent. Another flaw that I recognized was Bunton's argument that certain technologies would be obsolete without a value based healthcare model. That simply wasn't true. He included technologies that notified primary care providers when their patient was admitted to other facilities. But one can argue that this technology would be needed irregardless in order to display the full scope of the patient's medical history. Any physician would want to know when their patient was admitted to other healthcare facilities, again, to get the full scope of their medical history. Another technology he included was information about referral costs or predictive analytics that focused on patient care and improvement. Again, one can argue that these technologies would be desired for any healthcare worker working towards the betterment of their patient's condition, regardless of what healthcare model that is preferred. All in all, I viewed Bunton's argument as not fully sound in this discussion. Thank you.